development which is happening in these years is a long lasting for your future development, right?
Definitely.
It depends, your future depends on your early growth.
So this
Okay.
period of brain is called the window of critical development. And the term we use is neuroplasticity.
Okay, neuro.
So the child, जैसे अगर आप एग्जाम्पल समझो फॉर पेरेंट्स की, जैसे मिट्टी होती है ना, उसको हम मोल्ड कैसे भी कर लो, वो मोल्ड हो जाएगी, लेकिन एक बार वो मिट्टी पक गई, उसको फिर आप मोल्ड करने की कोशिश करोगे, वो टूटेगी, मोल्ड नहीं होगी. सेम विद द चाइल्ड.
Can we, does restricting giving screen to children with disorders worsen the situation?
Yes, depending. So I'll tell you why screen is not good or why screen is not recommended or avoided. Why should it be? So what happens is screen is a one-way communication. Okay. So autism and all these are communication disorders where the child, we need to give the child opportunity to communicate. Okay. But what is the screen doing? It's a one-way communication. The child, the screen is speaking and we are listening. But if we use the screen as a two-way communication, suppose for example video calling, that's a two-way communication. Right. Screen is okay for that.
So most of the parents don't feel comfortable if they detect if a child is found with certain developmental disorder. They don't feel ready ki other schools will accept my child, because most of the schools are not inclusive, right? So what are your thoughts? What would you suggest? When should such students should go to school? In which age?
So in preschool, I think all children should be included in a normal school.
Okay.
Okay? Because these are the formative years and the child is developing and he should get all exposure. And a lot of children improve going to a normal school who do have a speech and language delay without any interventions also.
So, hello parents. At Nalanda Gyan Jyoti, true learning begins when the child feels emotionally secured, supported, and understood. With that thought, we welcome you to conversations that build childhood. Today, we have our guest, Dr. Shruti Kumar, with us. She's a developmental pediatrician and a child health expert. So, she will help us to understand how early development and child support and emotional support helps to shape the child's future. Thank you, ma'am, for giving us time. So, Dr. Shruti, our viewers would like to know your developmental pediatrician journey and what all kind of questions parents usually have in general.
So actually, I've been a pediatrician since I graduated in 2001. Since then, I've been in intensive care in pediatrics, in newborn intensive care, and general pediatrics. But then, after a point, we felt a need. A lot of children who were being admitted in the NICUs and the PICUs and even otherwise in the ward, they went into sequelae and faced developmental disorders. Like those children who had birth asphyxia, did not cry at birth, or those who had severe jaundice at birth, or those who were on ventilators. They later on came to us with developmental delays. So we started having increasing, as our pediatrics advanced, we were saving more babies. The requirement for and understanding the development of the patient and doing something for that, which the children came with as sequelae, that became more and more. And there was no one in Uttarakhand that we could refer to these patients. Okay. So the team of IAP Uttarakhand had asked me to build this specialty in Uttarakhand. Okay. So that is where my journey started as a developmental pediatrician. Okay. And I went to Bharti Vidya Feed for my fellowship in developmental pediatrics. Okay. And after that, I started my journey of developmental pediatrics and established the first child development unit at Indresh Hospital, and now I have two more child development unit as Aksh Child Development Center.
Okay.
So with that journey, I started with a lot of workshops, sensitizing parents, sensitizing pediatricians, because at that time in 2016-17, not many pediatricians were so much sensitive towards these developmental disorders, and parents, though, there was much less awareness. Now things have completely changed.
Okay.
So I remember when I started the unit in Indresh and I was looking for an occupational therapist. So there was no occupational therapist in Uttarakhand, and there was one which was doing physiotherapy, because when I called him and said, why are you not practicing occupational therapy? He said, ma'am, nobody knows what is occupational therapy.
There's lack of awareness, basically.
So that was the point where I started.
Okay.
And now the scenario is completely changed. So there's so much awareness. Parents come with all kinds of complaint now themselves.
Okay.
Not only referred patients from pediatricians, psychologists, psychiatrists, neurosurgeons, neuropediatricians. Those patients are definitely are coming. But even parents directly are coming with complaints of not developing as per peers in any domain, like speech and language
What
delay.
are the most common developmental concern you have came across among the your parents in children?
So the most common complaint nowadays is speech and language delay.
Okay.
But all kind of complaints are coming, like children who are NICU graduates failing to achieve even motor milestones, not being able to sit, walk, children with school problems, school refusals, school complaints, anxiety disorders, then children with learning disabilities. ADHD has really become, it's like an endemic now. Everybody is coming and thinking. Even 2 years, I get parents coming, ki, my child, ma'am, 2 years, I feel he has ADHD.
Okay.
And the minimum age of diagnosis of ADHD is 4 years.
Oh, okay.
So it's difficult for parents to know, because we are never taught parenting. So parents don't know that attention span of a child is just 1 minute per age. So 2-year child will have attention span of only 2 minutes. But parents, just because he's hyperactive, that's good. So they fail to understand the difference between normal hyperactivity and ADHD.
ADHD. Okay. So nowadays, most of the parents, in our generation as well, our parents as well, they were focused primarily on academics and physical development as a developmental milestone, right? Can you elaborate can you give us insight about what are the other areas of development which parents should see instead of apart from academics and physical development?
So I will start with an example of a child. So I had a 2-year, 10 months old child, and the parent came, ki, ma'am, he knows tables up to 20.
Okay.
He can read books of his elder brother, है ना? But he doesn't say, "Mama, bhook lagi hai." So this is something in development we call as developmental deviancy. Means the child has achieved the milestone which is to be developed later, but he has not achieved the primary milestones which has to be achieved earlier. So he is not able to communicate, but he has rote learning. तो संस्कृत के श्लोक याद हैं, है ना? He knows गीता पढ़ लेगा, ये सिंपल चीजें, प्रेयर्स हैं, सब याद हैं, ABCD याद है, पोएम्स याद हैं, बट व्हेन इट कम्स टू कम्युनिकेशन वो पता ही नहीं है. So this is something that really is difficult for parents to understand also. कि speech तो आ रही है, तो it's difficult to pick up. So this is where there is lack in social communication. So socially, the child, if you ask the parents कि हाँ academically बहुत अच्छा है, पढ़ाई में बहुत अच्छा है, but बच्चों के संग interact ही नहीं करता. कोई घर में आता है तो अपने कमरे में चला जाएगा. So it's not only academics which is important. So the child in whole, in a community, adapts to the community is what is important. He is independent. He can eat himself. He can dress himself according to the age. and he can do a normal communication when somebody if the parents take him to a birthday party, if the parents take him to a marriage, he behaves appropriately to his age. Those are all very important things. A little bigger, the child accepts school. He accepts a change from one class to another class. That also becomes very difficult in children with autism. They don't like changes. So, one class, if you switch to another class, it is very difficult for them. So, a lot of developmental disorders will have very normal IQ. In fact, a higher IQ maybe. But their behavioral, emotional, that aspect is missing. Social. That so development is divided into many domains. Any domain which is lacking in according to the age is a problem for the child. So we need a holistic development of the child.
Not only
The
physical
academic
and academic.
Yeah.
Okay. So talking about ages, okay. We believe as a preschool, we believe that early child, we give really importance to 0 to 6 years, that is early childhood development. We believe that any kind of development which is happening in these years is a long lasting for the your future development, right?
Definitely.
It depends, your future depends on your early growth.
So this period of brain is called the window of critical development. And the term we use is neuroplasticity.
Okay, neuro.
So the child, जैसे अगर आप एग्जाम्पल समझो फॉर पेरेंट्स की, जैसे मिट्टी होती है ना, उसको हम मोल्ड कैसे भी कर लो, वो मोल्ड हो जाएगी. लेकिन एक बार वो मिट्टी पक गई, उसको फिर आप मोल्ड करने की कोशिश करोगे, वो टूटेगी, मोल्ड नहीं होगी. सेम विद द चाइल्ड. What happens is a child's brain is made with neurons, which are brain cells. And it is not only the neurons which are important, but what happens is neurons branch out. They have branches, and these branches, one neuron to other, there is a connection in these branches which is called synapse.
Okay.
The nerve impulses are all passed through these synapses, and these are the areas of learning, because that is how the nerve, all the impulses are passing on the whole brain, right? So that branching and rebranching is at its peak in 2 to 3 years.
Okay. Talking about children with certain development disorders, are 0 to 6 years also important for them for their later stage of recovery?
100%.
Okay.
Because
this is a disorder, right? Can disorder be treated, or you can say it is support? It can be supported.
So, if you're talking about neurodevelopmental disorders, they cannot be cured, right? Yeah. But they can definitely be managed.
Okay.
And we can reach at least a child's developmental potential. But if we don't intervene
at
early stage, at this 0 to 3 years, which is a critical period, the child will not reach its actual potential. I'll give you a very small example of a child with hearing impairment. So a child who's hearing impairment, he cannot speak. So a child with sensorineural hearing loss, we have a method of cochlear implant surgery where we can do that surgery and the child can learn to hear and then speak. So if that surgery is done within a year or 1 to 1.5 years, the child ultimately, along with surgery, with speech therapy, can go on to have almost normal speech and normal life. But if this surgery is done after 6 years, after 7 years, so we don't even do that surgery.
It won't be that effective.
Because that sensitive and critical period of language has finished. So this 0 to 5 years is a sensitive and critical period of a lot of brain development, lot of like vision, hearing, language, motor domain, lot of things, that this is a critical period. So if that is passed, then development will occur at small stages, but it's very, very slow.
So ma'am, for our parents who wanted to know, basically it is question from layman. So what are the early signs of ADHD or autism which parents should notice in a child right? So that they can take experts' help on time.
Okay. So one thing is that autism and ADHD are two different disorders.
Okay.
Okay.
So when in
They
general, we are saying
so
in general
I'll
disorder.
describe them differently.
Okay.
So, but 50% of the time they can coexist also. So that is why there's a lot of confusion between autism and ADHD.
right.
So if we talk about autism, the earliest sign to pick up is the child will not respond to name. So he will respond to things of his interest. Like if you say chocolate, the child will respond. But if you say whatever his name is, if you call out by his name, he will not respond. He will be lost in his own world. He will keep on doing whatever he's doing. So that is the earliest sign. The child is not responding to name. Other thing is the child does not give eye contact. So he may hear and do whatever you are saying, but he will not like to look at you. Another thing is a lot of times the child will slowly respond to name and give eye contact to his known people. But जैसे he will move out of the boundary of his comfort, again those symptoms will be shown more, they will be exaggerated.
Okay. So, ma'am, as we have discussed, what are the early signs that parents must see regarding ADHD and autism?
So autism I talked about. ADHD mein one thing is that before 4 years don't think about ADHD. है ना? And even for if really it is difficult to manage the child, don't think about the diagnosis, but you can consult us or any pediatrician regarding how to manage with behavior therapy. So it's basically parent counseling which we do. After 4 years, after schooling age, 6 years mostly, ADHD is known, and that also when a lot of times the child is really hyperactive, you get a lot of school complaints that the child is not sitting in the class, he's getting distracted, he wants to get up every time, he is careless, he leaves things. Every time you give him some pencil, he leaves it somewhere. He's not able to copy the classwork. He's good, intelligent, but because he's distracted, he's not able to copy.
So basically, these are the myths which are revolving around, because awareness of ADHD and autism are really in the market today, because thanks to our movies, thanks to our social media, everywhere people at least know about these things these days.
But sometimes they are overdiagnosed also by parents.
Yes, so that's what my parents would like to know. What are the myths running around, which
so not every hyperactive child is ADHD. That is one thing. That is very important to understand. So when the hyperactivity is to an extent that it is affecting the functioning of the child in any way, then we have to label it. And then another myth is that if you go to a developmental pediatrician or a psychiatrist, every ADHD will be given drugs. That is wrong. So we do not give medicines for ADHD before 6 years. It is the behavior therapy which is given, which is counseled to the parents, how to manage the child at school and at home to help the child. After 6 years only, we start with medication, and there's a lot of myth regarding medication that if you give the medication, the child will never be off from the medication. We should not give the medication, and a lot of myths have been spread even by therapists. They feel that not only for any developmental disorder, even for cerebral palsy and for autism, ADHD, they feel that medication should never be given. It will. But if you feel that the child, little bit of medication, titrating the dose, looking at the side effect, if it is helping the learning of the child, but that is what we want. And it is not something which we will not be able to taper off. We will be able to taper off. But they are, some parents and some therapists are like, नहीं medicine नहीं देंगे चाहे हमारे बच्चे की learning हो या ना हो. अरे अब बैठेगा ही नहीं वो, तो learning कैसे होगी? A little bit of medication, but yes, in small children we do not give. That is one myth. And in autism also, there are a lot of environmental factors which aggravate autism. But one myth is that my children developed autism because of screen.
Okay.
That is there. That is absolutely wrong. No children no children can develop autism due to anything. Yeah, I have not given time to my child. That is why my child has developed autism. No, the child had autism, which increased. The symptoms increased because of screen or because of not getting social interaction opportunities. But it is not that autism was always there. Even if you had not given scream, if you had socially interacted, the child still would have had autism, maybe a little milder form. So that is something which we need to understand, that autism can never be developed. These neurodevelopmental disorders are there from the beginning. It is just we recognize late.
Basically, birth disorder.
They are from birth only.
Okay.
Yes. And a lot of parents say, why my child? That is one thing. Why my child has developed? So, actually speaking, we have no answers. There are a lot of risk factors in which genetics has a major role, but not all autism are genetic autism. But yes, there are some 400 or so genes which are associated with autism. Even genetics has some component in ADHD also. But a lot of times, if we do genetic studies also, we may not get answers. So the yield in autism if we do genetic tests is only 30%. And depends on a lot of things. If there are some associated factors like motor delay also, then the yield increases. So there are a lot of things. But yes, at least for parents, you can know that there is a genetic component. But there are a lot of environmental factors. There are risk factors like the parents' age, stress in the pregnancy, some drugs are associated. So there are a lot of environmental factors also, preconceptionally or conceptionally and postnatal, which do affect. But there is no one-to-one causal factor we can say this is because of that.
Okay, there's not a proved
Like,
factor.
like in Down syndrome, which is a developmental disorder, trisomy 21. It's a chromosomal abnormality. It is from birth. But again, there are some risk factors, like increased in the maternal age is one of the most important risk factors for Down syndrome. But we have seen Down syndrome to mothers who are 19 years also.
Okay. Yes.
So it is not 100%.
Yes. So, lot of parents hesitate basically to come to experts' help because fear of labeling the child, right? So, how would you, recommend parents कि no, it is not some kind of a ban on a child. It is basically guiding a child for,
Better
a better
outcome.
outcome.
It's a very important question. I'm glad you asked, because I never believe in labeling. So when children come at a very small age, I will never, even if I know autism, I will never label it. So I always believe in enabling rather than labeling.
Okay.
So you should never label. So and a lot of times we counsel parents, we see what is the acceptance level of the parents. And in the first visit, new parents, it is never accepted. I know that. So I will say, so we don't use words like autism. We say that the child has these weaknesses, there are these difficulties, there are these concerns, and these are the strengths of the child. So let us, because this is a period of neuroplasticity, we can actually make a difference. Let us work on the weaknesses and use the strengths and enable our child. And let's see what's the diagnosis. We are not in a hurry to diagnose. But important is intervention. So we should not miss that period of neuroplasticity to intervene. That is important.
So coming to the screen time of children. So nowadays everybody is addicted to screen, and it's impossible to restrict children. Even in adults also, we can't restrict ourselves.
It is not impossible. It is possible.
But still, it is kind of a necessary evil, right? So in children, how would you say, how can we, does restricting or giving screen to children with disorders worsen the situation?
Yes, depending. So I'll tell you why screen is not good, or why screen is not recommended or avoided. Why should it be? So what happens is, screen is a one-way communication.
Okay.
Okay? So autism and all these are communication disorders where the child, we need to give the child opportunity to communicate.
Okay.
But what is the screen doing? It's a one-way communication. The child, the screen is speaking and we are listening. But if we use the screen as a two-way communication, suppose for example video calling, that's a two-way communication.
Right.
Screen is okay for that. If the parent is sitting with the child and using some educational material and interacting with the, oh look, what's this? Oh, what is happening there? So you can use a screen for that. Screen is not like an evil. So it's how you use the screen. That is important. But there are guidelines internationally and nationally which are recommended. So what the guidelines say, that parents, you all must know, till 2 years, no screen time except for video calling with the relatives. 2 to 5 years, it's 1 hour screen time that should be monitored, supervised, and mostly educational. And beyond 5 years, you have 2 hours screen time. And what they say, it's actually not 2 hours, it is whatever amount of screen which is left depending on the time that the child should have after the school, a routine physical activity, opportunity for social play. After that, if there is time left, that amount of screen time, again, that should be monitored and supervised and preferably educational.
So guided, you mean to a guided screen time, you can say.
Monitored and
Monitored.
yes.
Yes. Because in our school as well, we are providing a app, Practico app for learning app. It is a learning app wherein we tell our parents, similar kind of we agree to your point, it should be guided basically. So children are using it for revising their stuff which they are learning back at school. So we are also inculcating on same terms. Okay, we also encourage parents to use such learning apps.
Like in autism also, every therapist in the world, in every parent will be told no screen time, no screen time. But a lot of parents will say, मैम मेरा बच्चा जो स्क्रीन से थोड़ा बहुत सीख रहा था ना, जब स्क्रीन टाइम बंद किया वो भी खत्म हो गया.
अच्छा.
So that is correct because autism children are visual learners.
Okay.
So you should use screen on them depending on your child. If the child
But
is
it
good
should be
learner,
guided,
but
basically.
you should sit with the child, interact with him, and then you can use that time for a limited period. But don't use screen as a babysitter. That is my plea.
So, talking about school readiness, okay. So, most of the parents don't feel comfortable if they detect if a child is, found with certain developmental disorder. They don't feel ready ki other schools will accept my child because most of the schools are not inclusive, right? So what are your thoughts? What would you suggest? When should such students will should go to school? In which age?
So in preschool, I think all children should be included in a normal school. Okay. Because these are the formative years and the child is developing and he should get all exposure. And a lot of children improve going to a normal school who do have a speech and language delay without any interventions also. If there is just mild speech and language delay, and especially if it is only expressive language delay and it is not like communication disorder, they improve a lot in school. And even children who have communication disorder like social communication disorder, even autism, the school helps them give that social opportunity to link, interact, and a lot of, so preschool all children should receive. After that, going to a formal school like upper KG and onwards, where the learning becomes a little bit, there is a more learning and it's a structured kind of format. That school readiness is there with the child and that should be assessed.
So coming to when you said structured, right? So in every school is basically Montessori based or Montessori inspired. Most of them are traditional, right? So should parents seek for schools which is more hands-on activity? They have certain materials to play with.
That's a very controversial issue.
अच्छा.
So yes,
हाँ,
definitely.
हाँ.
So we want, what is a school system? Why we need school? School is not just for academics. School is for bringing out the most in a child. So we need a school for forming the, not only getting the child ready for society.
Okay.
So of course it should be a holistic development. That should be, it needs some teamwork activity, which can be, the medium can be any, it can be music medium, it can be sports medium, है ना? The child should have physical, like even आपके there are a lot of recommendations on how much physical activity child requires per day. So school should have some amount of physical activity also. So now yoga and other things are also being introduced. Like
Basically, holistic
it's a, it should
development.
be a holistic. So this child should be ready for a school. That is very important. But
Okay.
one thing which I must tell for parents is, the school is for learning of a child. But if you feel there's a child with special needs and who is not, the learning that the child is receiving in this, he's not learning from that normal school. That is the time you need to put him in in some school which can help the child learn better. So just putting him in a normal school is not the only answer. That depends on the level of the child. If the child can integrate in the society and with some support, either a shadow teacher or whatever structure the inclusive school has, the child's learning goes on, it's okay. But if the learning stops in that school, then that is a time the child should be removed from that school.
Okay. So, how does early intervention with developmental disorder help the most?
How it helps?
As in to get the best learning outcome, achieve
So
the learn.
it changes the developmental trajectory altogether.
Okay.
So we have, it's been like 10, almost 2016 onwards, it's been almost 10 years now in this field. And I have seen children that at that time when I started, who came to me with diagnosis of autism at 2 years, 2.5 years, they're doing extremely well. Some of them, parents keep on sending videos. They are in class now, second, third, and they're doing extremely well. In fact, some of them are like competing in some competitions, Olympiad and all. They're doing extremely well, but not all.
Okay.
So early intervention is the answer. So you have to, because you have to use that period of neuroplasticity, and at the right time, given the right exposure, the right environment, will help those synapses, and then the child will reach that maximum potential. That is our aim.
One message which you would like our parents to give, okay, to give to our parents, one reassuring message rather, for the children who are facing ADHD and autism problem, so that parents are more confident, as in ki, to take therapy or child health expert opinion.
So, very important is early identification and early intervention. So, whenever any parent feels that my child is not developing as per other children of his age, be it in any domain, please seek expert advice and see what your child, how we can help your child. So it is not important that to label the child, but it is definitely important to help your child. And whatever advice according to whatever your child is, do seek help and do intervention, because don't miss out in this opportunity. There are a lot of myths like my child will speak late, boys speak late, हमारे ग्रैंडफादर ने भी लेट बोला था. तो ये वाले जो मिथ्स हैं, डेफिनेटली जेनेटिक कंपोनेंट होता है ना, बट डोंट वेट फॉर दैट, because a lot of disorders later on अगर हम इंटरवेंशन नहीं करते तो आउटकम चेंजेस टोटली, द सिनेरियो, होल सिनेरियो चेंजेस. So whatever, don't worry about the label, do seek expert advice and do intervention whatever is told to you by the expert, so that you can help your child achieve his maximum potential. And don't worry about the society कि वो लेबल हो गया, वो ये हो जाएगा, वो डोंट वरी अबाउट द सोसाइटी, बिकॉज अल्टीमेटली वॉट एवर द आउटकम यू गेट, यू आर एमिंग फॉर दैट बेस्ट आउटकम, है ना. तो इट इज योर चाइल्ड, ultimately you are answerable. Whatever situation you will face, it will be you who will face it.
Okay. Thank you, Dr. Shruti, for your insight. So, at today's conversation, we have learned that when children are supported emotionally and when they feel secured and there's early intervention, learning happens naturally and development happens itself, right? So, at Nalanda Gyan Jyoti School, we have always aimed to create an inclusive environment where we create safe, secure environment for each and every child, so that their development comes naturally and they can achieve best learning outcomes. Thank you, Dr. Shruti, for your time. Thank you.
Thank you, Jay.